Well,
We're ready. We're ready.
we are ready. We are definitely ready for some upgrades. We're ready for some changes. We're ready to get back out and see the world and experience the world and live life and all that good stuff. And we've been talking about vaccines all week. We've been talking about the way that the system has been. It's been good. It's been bad. It's been in between. It's been people have been reacting in different ways. And this morning, I want to discuss a little bit about how we can help to upgrade the system, upgrade how things work. And to do that, I want to welcome the Business General Manager at Digicel, Mr. Lawrence Modest. Good morning, Lawrence.
Good morning, Ruckus. How are you doing, man?
I am good. Thank you so much for joining us this morning.
Thank you for having me.
So, I understand that Digicel has been transforming healthcare systems outside of Trinidad and Tobago. Can you tell me a little bit about that work that you guys have been doing?
Right. So a lot of that work stemmed from projects that we started in Barbados, probably about two and a half years ago. And our view right now is really how we could improve on healthcare systems regionally, noting that most healthcare systems actually have a manual backbone, right? So we're not going to harp on anything that happened in the past couple of weeks, but what we'd like to see is a scenario where, for example, let's look at this vaccination process. Imagine if you have registrants being able to apply or make appointments for vaccines online via some form, or even better, maybe a mobile app, right? And then they can get messages about their appointment details, reminders, and so on. You could even have scenarios where, the hospital administrators are able to narrowcast a person with specific comorbidities, or you could see the collation of data, metrics like mean time to vaccinate, the staff complement on hand, how many doses you have left available at a particular site, and so on. That does two things, really. That gives you precise data that could be used to better plan your task, your deliverables, your outreach. But then it also, engenders a sense of certainty and confidence in the system. And I think confidence is something we definitely need to, show up these days, right?
For sure. But tell me something. In terms of doing it, you said it did it in Barbados, and it was same healthcare, right?
Yeah.
All right. Tell me some of the challenges that you would have faced, because I assume that changing a system from a manual system where we write down information and store it in files and folders and cabinets and all that, and people are accustomed to that system that works a particular way. What are some of the challenges that you would have faced in Barbados when you try to change that system?
You have just identified probably one of the key issues. The greatest challenge, I think, is educating people away from the way that they become accustomed to doing things. If it's familiar, it's easy. I can do this with my eye closed. You always get the questions of, well, why do I need to do it this way? And there's a process of engaging the stakeholder and getting there to understand, okay, this is how this can benefit you. In parallel, of course, you're looking at ensuring that you have the right sort of connectivity, the right sort of backbone infrastructure. If it's, storage, we prefer to look at a cloud-centric model. Right. So that all of the data is stored securely in the cloud. We provide redundant access to that. It's encrypted so that, even in the event of a natural disaster, let's say, you don't have to worry that all your systems are down. It's securely replicated on or off island, as the case may be. But certainly educating the stakeholders as to the benefits that accrue to them by implementing the system, and actually then breaking it up into bite-sized pieces, right? So it's not just about, here's this massive 5-year plan or 3-year transformation plan. Let's break this up month by month. These are the people we will work with in this particular sector or section, and we kind of walk them through those baby steps until completion.
And you guys are proposing to do that here in Trinidad and Tobago as well?
We are. We have some proposals in front of the government, and of course, negotiations are ongoing. One of the focuses for us, though, is looking at cost. Right? We understand the constraints. We know COVID is indeed the new normal, and we know the impact that has on the economy and so on. So what we're proposing is an OPEX-based model. So we would basically, as a digital provider, absorb all of the capital expenditure that's involved to get these systems in place. And then working with the government, we say, okay, here's a small monthly cost per user per month to take this forward. So Cabinet doesn't have to come to the public and say, we need to increase the budget by $100 million in CapEx to get the system off the ground. We don't see that as being tenable. And we see our relationships with governments as being long-term partnerships. So we support them as best we can, and then do the work on the back end where the cost is concerned in particular.
All right, Lawrence, I want to take a step back here and just break down what you say just now, right? What you said is that Digicel is willing to provide this for free, basically, absorb all the costs of this.
We're absorbing the capital expenditure, that upfront cost.
So the
right?
upfront cost. That's what I mean, the upfront
Yeah.
cost, right?
And
But
then
then
there'll be a
who
small
is,
cost per user ongoing.
when you say per user, you mean the public who's using the system, or is it the doctors who's using the system? Is it
Right.
the individual hospitals? Who's the user?
The end user would be the administrators of the system, and that I believe would be a partnership with the government. So we don't want to transfer any costs, any more burdens onto the citizenry.
Right.
So we would be working with the government to say, okay, this is, if on average we're reaching out to maybe 5,000 persons a month, this is what the cost for that would be monthly, and we deal with that accordingly.
Okay. All right. So you're willing to absorb the big expense to get the thing started, and then work out a situation with the government as to how it can go forward from there. Tell me some of the benefits to the public of this, because I mean we see that even with the WhatsApp situation with the vaccine, right? A lot of complaints came in to the minister, and the minister claimed that people saying that they don't have access to WhatsApp, they don't have access to certain technologies to be able to access this. So how do we help fix that part of the problem where some of the public still don't have access to smartphones or devices that would allow them onto the internet?
Right, and I think again that is part of understanding your stakeholders. So it should be a multi-format approach. So it's not just via smart devices, but you want, some people may have internet at home or internet-enabled devices. Everybody's walking around with iPads and whatnot these days. Well, some of us.
Not everybody. Not everybody at all.
Some of us. But certainly you'd want a system that could speak to that, but then also send basic text messages. You'd also want to have some sort of media campaign. So one of our sister companies, Trend Media, would be involved in doing, the rollout in terms of social media marketing and that type of thing. So you're covering all the bases. It's not just the technocentric individuals, but then, even if you have your print ads, certainly you'd have your ads on television in partnership with TTT and so on. And then, of course, you'll have your text messages. So you cover the full gambit in terms of that outreach part of the scenario.
Okay, all right. Well, this sounds like it's very interesting. How long do you think this will take to, when you'll get the go-ahead, how long would it take to integrate the system to get it up and running so that people can access and use it?
So end state, you're probably looking at 16 plus months. But certainly, probably within the first 4 to 5 months, you would start seeing a change in services at some of the health centers, the clinics, and so on. And then just from the Ministry of Health's website, you'd have a different type of engagement in terms of services that you can now access via that portal. Yeah, so even walk-in services in clinics you'd see an improvement, I think, within about 4 to 6 months.
4 to 6 months. Tell me something and be honest with me. Did you guys send this proposal like recently after you all realized, all right, maybe we should come on board and assist with transforming this, or has this proposal been sitting down for a while?
I think I wouldn't say a while, but I think certainly the conversations have become re-energized, given some of what's going on in the current environment. And we've also been asked to provide proposals on other things involving vaccination, maybe ways we could reopen borders, that type of thing, right?
Okay. Lawrence, you might make a good politician. That was a very, very politically
I don't know if that's a good or bad.
Either way, it was a well put answer. All right. So I mean, I think that this is fantastic. This is what the definitely we've been calling for, this digitization of the healthcare system. I think for me, one of my biggest concerns is how do we ensure that the information that is already stored, the cabinets of information, the floors of filing cabinets that we have in the various hospitals and the various ministries, how do we make sure that that information is transferred properly and correctly and quickly?
Right. Quick, if you're talking about years of cabinets, quick would be relative, right? But we would have a cross-functional team which would be chaired by some of the persons at Ministry of Health and so on. And basically there's a digitization campaign. So persons sit in these rooms and basically scan and upload this information, 12, 14, 20 hours a day. But we want those stakeholders present just to make sure there aren't any, issues or nuances, things we got wrong. So that data is vetted, it's verified, and it's uploaded. We have multiple data centers in Trinidad and then across the region. Now, I say across the region, understanding that, with data sovereignty laws and that type of thing, the government may say, no, all that data needs to reside on island, which is fine.
Right.
So we take care of that component. And then, of course, we focus heavily on the security of that infrastructure, not just the physical security, but the IT security, because you're well aware, one of the, frequent incidents we're seeing now is all these ransomware attacks and so on. So we ensure that our data is encrypted securely end to end, so that even if you gain access to the infrastructure, there's little or nothing you could do with it, right? And we have very competitive service level agreements that we would ensure we work out with the government, and we literally put our money where our mouth is, right? If we are in breach of our SLA or we fail to live up to that SLA, there are penalties on us. Right. That is, again, just to engender the level of confidence and certainty that the government needs.
Well, this sounds like it's very interesting, and I encourage you to continue pursuing it, and I hope that we're able to see the fruits of it very, very soon, because I think we definitely need it in more than just the healthcare system. But that's a whole other conversation that we'll get into another time. I want to thank you so much for joining us this morning, Lawrence Modesty, Business General Manager at Digicel. We're looking to upgrade the system. No problem, man. Take care. Stay safe. We're upgrading the system, and you can be a part of it. We'll take a quick break and come back right here on the Now Morning Show.